Students, today we will start with a covering of the heart which is called as pericardium. So here it is a very good illustration where we can appreciate the middle mediastinum, and here the lungs are removed, exposing only the mediastinal structures. So this is the pericardium covering the heart. So the whitish colored structure, the tough layer is the fibrous pericardium covering the heart. It is a fibrous serous sac. It is not only fibrous, it contains the serous membranes also, so which encloses the heart and also the roots of the great vessels. So you can see the roots of the great vessels which get origin from the heart and terminate in the heart are also enclosed by this pericardium. So pericardium is located in the middle mediastinum. So here we can appreciate middle mediastinum. So it is located in the middle mediastinum. Posterior to the body of the sternum. So sternum is removed and ribs are removed anteriorly to expose the middle mediastinum. So it is related anteriorly to the body of the sternum and second to sixth costal cartilages. So it is related to sternum and second to sixth costal cartilages, and posteriorly it is related to the fourth T4, that is almost the lower border of the T4. So we can say it as T5 to T8 thoracic vertebra. So posteriorly it is related to T5 to T8 thoracic vertebra. So the functions of the pericardium, as it covers the heart, it limits the cardiac distension. Cardiac distension means over dilatation of the heart is called distension. So it limits the cardiac distension and restricts the excessive movements of heart. And pericardium serves as a lubricated container in which heart can contract and relax smoothly. So these are the main functions of pericardium. Let's see the components of pericardium. Pericardium consists of two components. The outer layer of the pericardium is called as fibrous sac, which is called fibrous pericardium. And this fibrous pericardium, it is outer dense fibrous layer and it is blends with the adventitia of the roots of the greater vessels. Means the outer layer of the blood vessels is called tunica adventitia. So the pericardium, fibrous pericardium blends with the tunica adventitia of the roots of great vessels, and inferiorly it blends with the central tendon of the diaphragm. So this is So here is the schematic image for you to understand the pericardium and its components. So this represents the roots of great vessels. So the fibrous pericardium blends with the outer layer of the roots of the great vessels superiorly, and inferiorly we can see it blends with the central tendon of the diaphragm. So next about the serous pericardium. So the serous pericardium, it is an inner double layered serous sac which is considered as serous pericardium. It is further divided into parietal and visceral layer. So the outer layer is the and inner layer is the visceral layer. So the parietal layer of the serous pericardium lines the inner surface of the fibrous pericardium and it reflects as the visceral pericardium on the outer surface of the heart. So the visceral pericardium is called as epicardium. So we can see the visceral pericardium lines the outer surface of the heart, which forms the epicardium. So to understand the relations between the fibrous and visceral pericardium and the heart, it is important to know a little explanation of embryology, which makes it easier to understand the formation of different layers of pericardium. So here is the schematic image showing the formation of heart. This is developing heart and the outer fibrous pericardium, and the blue lining is the serous pericardium enclosing pericardial cavity, and this pericardial cavity is invaginated by the developing heart. So the fibrous pericardium is outer. So the heart is present within the fibrous pericardium but outside the serous sac. So the heart and the great vessels, they lie inside the fibrous sac and they invaginate the serous sac from behind during development. So as a result, the external surface of the heart and the internal surface of the fibrous pericardium are covered by a layer of serous pericardium. So this is these two serous pericardium. This is fibrous pericardium. So the layer covering the surface of the heart is called as the visceral layer. So the one which is along the heart, this is the visceral layer. On the other side, which is along the fibrous pericardium, this is parietal layer. So I hope it made it easier for you to understand. So the visceral layer is otherwise called epicardium because it is the layer which is present along the heart, whereas the parietal layer is present on the inner surface of the fibrous pericardium, so it is called parietal pericardium. So the intervening potential space which is between these two layers, between these two serous layers, is called as pericardial cavity. So you can see here, this is pericardial cavity. Let's talk about the fibrous pericardium. So the fibrous pericardium is a strong fibrous sac. So here this reflected one is the pericardium, which supports the delicate serous sac, that is the parietal and serous pericardium, and where the parietal is firmly adherent to it. And if we see the fibrous pericardium, it is conical in shape, and anteriorly it is related to the posterior surface of sternum, and it is connected to the sternum by superior and inferior sternopericardial ligaments. Posteriorly, if you try to lift the heart and see its posterior relations, posteriorly it is related to the thoracic aorta. So here the arch of aorta continues. So if you remove the fibrous pericardium, this part is related to thoracic aorta, and it is also related along with the aorta to esophagus, right and left principal bronchi, which are the bronchi arising from trachea. On either side it is related to the phrenic nerves. On each side we can see the phrenic nerves. These are the phrenic nerves. So which are present on each side of the fibrous pericardium. So next we move on to serous pericardium. It is a serous membrane lined by the simple squamous epithelium, which is called as mesothelium. Serous pericardium, we know it has got two components, parietal pericardium and visceral pericardium. Visceral pericardium is otherwise called as epicardium. So talking about this parietal one, parietal is adherent to the fibrous pericardium. We can see it is along the inner surface of fibrous pericardium. Parietal pericardium develops from the somatopleuric visodum. So it is innervated by somatic nerves. It is sensitive to pain because it has got pain receptors. Next, moving on to this visceral pericardium or epicardium. It is adherent to the myocardium, means the outer surface of the heart, and it develops from the splanchno-pleuric lateral plate mesodum. And so it is developed from splanchno-pleuric. So it is innervated by autonomic nerve fibers and it is insensitive to pain. Let's see the pericardium blood supply and the nerve supply. So starting with the arterial supply, the fibrous pericardium and parietal layer of serous pericardium are supplied by the branches of internal thoracic artery. So here the other one here. So this is the internal thoracic artery along with the internal thoracic vein, and the nerve is the phrenic nerve. All three are here, and we can see the phrenic nerve, internal thoracic artery and internal thoracic vein on the other side. So it is mainly supplied by the internal thoracic artery. So it is supplied by the internal thoracic artery, that is pericardiophrenic branches of internal thoracic. Apart from internal thoracic, musculophrenic arteries, descending thoracic aorta, that is esophageal branches from descending thoracic aorta, supplies the parietal layer of the serous pericardium and fibrous pericardium. Let's talk about the visceral layer, that is the inner layer. So visceral layer, we know it is along with the heart. So the visceral layer of serous pericardium, it is supplied by the coronary arteries which supply the heart. Moving on to the nerve supply, phrenic nerve, vagus nerve and sympathetic nerves are the nerves which supply. So the fibrous pericardium and parietal layer of serous pericardium are supplied by phrenic nerves. So we can see here. So these are the phrenic nerves which are along with the internal thoracic artery and vein. So the phrenic nerves are the somatic nerves which supply the fibrous pericardium and parietal layer of serous pericardium. Moving on to the visceral layer of serous pericardium is supplied by the sympathetic trunks and vagus nerves. Sympathetic, vagus forms the parasympathetic, both together called autonomic nerves. Thus, the fibrous pericardium and parietal layer of the serous pericardium are sensitive to pain, whereas the visceral layer of the pericardium is insensitive to pain. Thus, pain during pericarditis, if there is any inflammation of pericardium, is called pericarditis. So, during pain in the pericarditis, they will have a referred pain in the neck because the phrenic nerve supplies it. So, coming to the clinical correlation, as pain sensation carried by the phrenic nerve often referred to the skin, that is the dermatomes which supply the skin between C3 and C5 segments, because the phrenic nerve root value is C3 to C5, and often the pain is radiated to the ipsilateral supraclavicular region, means the same side supraclavicular region it gets radiated. Let's talk about the pericardial cavity. Pericardial cavity is the potential space between the visceral and parietal layers of serous pericardium. So, this yellow one is the pericardial cavity, which is the potential space between the visceral and parietal layers. So, it is lined by the mesothelium. Normally, this pericardial cavity contains a small amount of fluid called as pericardial fluid. So, it contains around 20 ml of pericardial fluid, which allows friction-free movement. It is like a lubricant around the heart, so which allows the friction-free movement of the heart during diastole and systole. So, the reflections of the serosal layer are arranged in two complex tubes. So, the tube between the aorta and the pulmonary trunk encloses one recess. This is called as transverse sinus or transverse recess. And the other one, it is enclosed by the vena cava and 4 pulmonary veins on the other side. So, this one is oblique sinus or oblique recess. The transverse sinus we can appreciate here as a passage. If you take a section like this, we can see here transverse sinus. Anteriorly it is related to the aorta and the pulmonary trunk, and the gap here where the arrow is present is the transverse sinus, and the atria are present on the posterior aspect. So here this is the right atrial cavity. This is left atrium. So moving on to the oblique sinus, the perivenous tube is like an inverted J. So you can see here, this is like this. So inverted J like. So this is called as oblique sinus. So oblique sinus is a perivenous tube which is like an inverted J. It is like called cul-de-sac. So within it's covered posterior to the left atrium. So it is present posterior to the left atrium and it is termed as oblique sinus. Oblique sinus of the pericardium is the recess of serous pericardium behind the base of the heart. So actually behind the left atrium. So this is the left atrium. So here the heart is removed. So left atrium is removed here, exposing the oblique sinus. So anterior structures are not seen. So anteriorly it is related to the left atrium of the heart. It is like a closed J-shaped sheath of visceral layer of the serous pericardium enclosing 6 veins. The 6 veins are 2 vena cava. So you can see vena cava and 4 pulmonary veins. So this is the superior vena cava and we can see so pulmonary. So totally it is present almost within the 6 veins. So the oblique sinus develops as a result of absorption of 4 pulmonary veins into the left atrium. The oblique sinus permits the distension of left atrium during return of oxygenated blood, that is during the venous return from the lungs. So return of oxygenated blood into the left atrium from the lungs. So let's do a small summary. So the transverse sinus lies between the arterial and the venous sleeves of pericardial reflection. So anteriorly the transverse sinus is related to the aorta and pulmonary trunk. So anteriorly aorta and pulmonary trunk are related. Posteriorly it is related to the atria, that is left atrium, right atria, and also it is related to superior vena cava. We can see here superior vena cava which is related posteriorly. So the finger represents the transverse sinus here in this image, and inferiorly it is related to the upper surface of the left atrium. So here is the upper surface of the left atrium which is related inferiorly. Let's see the boundaries of the oblique sinus. Oblique sinus is a recess of serous pericardium behind the base of the heart and lies within the venous sleeve of pericardial reflection. So anteriorly it is related to the left atrium. So here the left atrium is removed to show the oblique sinus, and posteriorly it is related to the parietal layer of pericardium. So this is the parietal layer. Superiorly it is related to upper margin of the left atrium. So here the left atrium is also removed. So upper margin of the left atrium it is related, and left it is removed to the left pair of pulmonary veins. So these are the left pair of pulmonary veins. On the right it is related to the right pulmonary veins and inferior vena cava. So these are the boundaries or relations to the oblique sinus. Some additional points are surgical significance of the transverse pericardial sinus. So during cardiac surgery, after pericardial sac is opened, so the anterior a finger is passed. So how here the finger, same way the finger is passed to the transverse sinus of pericardium posterior to the aorta and pulmonary trunk, and a temporary ligature is passed through the transverse sinus around the aorta and pulmonary trunk. So the tubes of the heart and lung machine is inserted into these vessels and ligature is tightened. So that is the procedure during open cardiac surgeries. So next about pericarditis or inflammation to the pericardium is called pericarditis, and we shall also discuss about cardiac tamponade. So the inflammation of serous pericardium is called as pericarditis, which causes the accumulation of serous fluid in the pericardial cavity, which is called as pericardial effusion. The excessive accumulation of the serous fluid in the pericardial cavity. We know how much is the amount of pericardial fluid? It is around 20 ml. If the accumulation of fluid is beyond the 20 ml, it is called as pericardial effusion. So, which may compress the thin-walled atria and interfere with the filling of the heart during diastole, and consequently the cardiac output is diminished. So, this condition is clinically termed as cardiac tamponade. So, compression of the atria because of enlarged pericardial cavity, it is called as cardiac tamponade. So, in pericarditis, it is like a terminal event in uremia, that is the final stage of chronic disease. We see the pericarditis. The next common procedure associated with pericardium is pericardiocentesis. Pericardiocentesis is a surgical procedure of pericardial cavity for the aspiration of the excess fluid. So there are two approaches to reach the pericardial cavity. The first approach is the sternal approach, where a needle is inserted into the pericardial cavity through fifth intercostal space left to the sternum. So via the fifth intercostal space, just adjacent to the left side of the sternum, we insert the needle. That is one procedure. The second way of inserting needle is sub-xiphoid approach. That is, the needle is passed 1 to 2 centimeters to the left of the costo-xiphoid angle, that is at 45 degrees to the skin, and then upwards and backwards towards the tip of the scapula. So until it re-enters the pericardial sac, that is called sub-xiphoid approach. Next, because of this cardiac notch which we have seen in the left lung, so the needle misses the pleura and lungs, but it penetrates the pericardium in sternal approach. And the needle penetrates in this way, like it penetrates first skin, superficial fascia, then it penetrates through the pectoralis major muscle, external intercostal membrane, internal intercostal muscle, transversus thoracic muscle, and finally it pierces the fibrous pericardium and a parietal layer of serous pericardium to reach the pericardial cavity. The last condition is about the pericardial friction or rub. We are going to discuss. The pericardial friction rub is the roughening of the parietal and visceral layers of serous pericardium by inflammatory exudate, that is the fluid that filters from the blood into the areas of lesion like pus or a clear fluid. So it can cause friction between the two layers of parietal and visceral layers, which is called as pericardial friction rub, and which can be felt on palpation and heard through the stethoscope. So these are the clinical correlations which are associated with the pericardium. Thank you.